Amyotrophic lateral sclerosis, it's one of the most devastating neurodegenerative diseases, and it's also another name for it, Lou Gehrig's disease, after a famous baseball player named. And this is a disease of people in their late adult years, 50s and 60s. And the disease is very progressive, and usually from the time of onset of symptoms it takes to approximately 2 to 5 years to death. So what happens and why the disease has this name? Let's talk a little bit about this. It's a death of lower motor neurons that occurs, and when the lower motor neurons dying, at the same time the denervation of course occurs, and there are no nerves connected to muscles, the muscle mass or the muscle fibers shrink, and so muscle fiber will present with atrophy. This type of atrophy, secondary to disease of the nerves or death of the nerves or denervation, will be called amyotrophy, and that's why the disease's name is amyotrophic lateral sclerosis. The term lateral sclerosis reflects the fact that nerve fibers in lateral columns of white matter of the spinal column are affected and lost. At the same time, disease does not affect the intellectual abilities, the regulatory mechanism of coordination and control of movement, and sensory systems. The neurons of the neurons of ocular systems are also parasympathetic neurons, and they are also basically ocular mobility in the parasympathetic neurons in the spinal column also spared. The cause again is uncertain. There is some familial history, and it's a very small share, relatively small share of affected patients, but otherwise it's not really determined why the disease happens. And there are several mechanisms of ALS occurring, and there is possibility of injury to the nerves through glutamate gated ion channels, which will be distinguished by sensitivity to N-methyl-D aspartic acid. But again, it's one of the theories, and there is no certainty what causes the disease. There is autoimmune source also described or suggested, but disease at the same time would not respond to immunosuppressants, so possibly it's not autoimmune. But again, there is no cure really for the disease, and the care basically palliative. The patient will be exposed to rehab techniques, so patient may cope or may maintain the independence as longer as possible to prolong the survival times, but unfortunately there is no cure for the disease. There is a drug, it's an anti-glutamate drug, again, and it's named Riluzole, but Riluzole is, and it's approved by FDA for the treatment of disease, but unfortunately the use of drug prolonged the survival only by 3 to 6 months, and they did trials, but it's already approved drug, so hopefully there will be something else on the market soon. But again, the take-home message about this, the atrophy of the muscles, the disease also will not affect the intellectual abilities at all, but symptoms of ALS will be a result of muscle deficits, and patient may experience such consequences as dysphagia, dysarthria, and dysarthria doesn't have anything to do with joints. It's inability to talk or articulate the speech, and dysphonia. Again, in rehab evaluation and treatments, it's important to involve the entire healthcare team, and by healthcare team I mean not only nursing and medical staff, but also auxiliary services such as speech therapy and physical therapy. Again, the goal is to prolong the survival time, or which is better, to provide the quality of life, to maintain the quality of life, not just prolong life. Neuropathies are peripheral neurosystem disorders. And neuropathies, truly, it's not a single disorder, but it's some type of collection or cluster of disorders. And neuropathy occurs when... So, talking about Guillain-Barre Syndrome, this is an acquired inflammatory disease. And another way to describe the Guillain-Barre Syndrome is as an acute immune-mediated polyneuropathy. So clinically, we can define it as a rapidly progressive weakness of the limbs and loss of tendon reflexes, and technically the Guillain-Barre Syndrome will be the most common cause of acute paralysis. And because currently that's the Guillain-Barre Syndrome, but of course in the past it was poliomyelitis. There are several types of Guillain-Barre Syndrome, which at this time we will focus on main type of the syndrome, and which we will be talking about Guillain-Barre Syndrome that has an immune component. So in Guillain-Barre Syndrome, some type of exposure to a virus or an offending agent occurs, and the studies done in epidemiology, they linked the infection to Campylobacter, cytomegalovirus, Epstein-Barr, and Mycoplasma. And majority of the patients will report that they had flu-like illness prior to the onset of symptoms. And some patients will have antibodies against gangliosides, which in some cases it would be consistent with infections with Campylobacter. So what happens symptomatically? there is progressive ascending muscle weakness of the limbs, and it will produce a symmetric flaccid paralysis. Paresthesia will occur, and at the same time loss of loss of motor function. Progression is relatively fast, but it may vary, of course, the speed. Disproportionate involvement of upper or lower extremities may occur, and paralysis in ascending case will be progressing upward, and there is significant number of people with Guillain-Barre syndrome which will present with involvement of respiratory muscle. Autonomic neurosystem also can be involved, and when we have autonomic involvement, we are exposed to the dangers of cardiac arrhythmias, and also the symptoms like autonomic dysfunction symptoms such as sweating and facial flushing, urinary retention. But at the same time, patient with autonomic dysfunction will have postural hypertension. Orthostatically, you will get different numbers, and also patient will have quite significant amount of pain in some cases. It's a medical emergency, Guillain-Barre syndrome, but at the same time it's very treatable. Approximately 90% of people affected will achieve full recovery, but the problem with this, and there is no problem really with this, but it's the duration. Unfortunately, recovery takes up to 1 year to fully recover, and sometime patient will require ventilatory support to treat Guillain-Barre because of and also support of other vital functions, and patient may need supportive care to prevent skin breakdown, thrombophlebitis, and again the treatment is mostly supportive, and also ventilatory supportive involvement of respiratory muscles is present, and at that time patients will require ventilatory assistance. So, but overall the recovery rate is approximately 90%, and patients will present with full recovery up in 1 year.